Today we have some of their representatives to be with us. They are the head of the National EMT team, Mr. Wang Yansen, Deputy Head of the Wuhan City Medical Team, Deputy Director of the Surgery Severe Case Department, Mr. Duan Jun, Deputy Head Nurse of the Lung Transplant Department, Madam Sun Ting, Respiratory Therapist, Mr. Xia Jinggen from the Respiratory Diseases and Severe Case Department, and they will take your questions. Some updates on the pandemic in the 24 hours of May the 8th, according to reports from provinces, cities, and Xinjiang Production and Construction Corp. New confirmed case 1. It was an imported case in Tianjin. There was no new death. New probable cases 2. Both were imported cases found in Shanghai. On the day, newly cured and discharged from hospitals 53. Close contacts that were removed from medical observation 617. Severe cases were reduced by 3. Some information updates on imported cases remaining. Confirmed imported cases 176, including 4 severe imported cases. Remaining probable imported cases 8. Cumulatively confirmed imported cases 1,681. Cumulatively cured and discharged from hospitals 1,505. There was no death case among imported cases as of 24 o'clock May the 8th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. Remaining confirmed cases 208, including 15 severe cases. Cumulatively cured and discharged from hospitals 78,046. Cumulative deaths 4,633. Cumulatively reported confirmed cases 82,887. Remaining probable cases 8. Cumulatively traced close contacts numbered 736,372. Close contacts that remained under medical observation 5,859. On the front of new asymptomatic infections, 15. None of them were transferred to the category of confirmed cases. 32 were removed from medical observation, including 8 imported asymptomatic infections. Asymptomatic infections that were still under medical observation 836, including 63 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,529, including 1,044 in the Hong Kong SAR, 45 in the Macau SAR, and 440 in the Taiwan region. In the past 14 days, across the country, newly reported imported cases numbered 52. All were introduced through airway ports. Currently, the pandemic is still rampaging across the world. There is continuous pressure for us to prevent imported cases. We need to expand the coverage of tests for all the inbound travelers. Those should be tested, must be tested. We should have a closed-loop management in place to prevent any possible revival of the cases. Now we'd like to take questions from the journalists. Please ask questions on today's topic, and please identify yourself before you ask questions. The first question goes to the journalist on the first row on the right side, please. Thank you. With the Yangtze Daily, I'd like to thank the medical team composed of the team members of China-Japan Friendly Hospital for saving lives at the risk of your lives. I'd like to ask whether you had any concern or even fear when you stepped into the field hospitals. Was there anything that you saw that was actually different from what you have imagined before you left? I'd like to ask Mr. Wang Yansen to take the question. Thank you for your question. Thank you for your concern and attention given to the field hospitals and our team. For our team, we arrived in Wuhan in the earliest time. We participated as the whole formation, which was composed of the nurses, doctors from radiology, testing department, surgery, ICU, respiratory departments. We've been working in the Dongxihu Field Hospital and later in Guanggu Field Hospitals. We've been collaborating with other medical teams that have been assisting Wuhan. All of us it has been the first time for us to treat all these patients. We've altogether treated and diagnosed 4,300 plus patients, and we realized that zero death and zero infection among the health workers. The field hospitals are different from general hospitals. They were makeshift hospitals, but they could provide the basic care and medical services to the mild cases. Just as its name suggests, it is a field hospital where hundreds or even thousands live together. Some patients have been transferred to hospitals from the observation quarantine venues. There were questions as to whether patients could adapt to such an environment, whether we can pacify them to get the diagnosis and treatment. This was one concern for the medical team members. However, fortunately, we were thinking the worst scenario, but we have been preparing with the best approaches. We've imagined different scenarios when we received the actual cases. We saw that patients come in dozens. Sometimes in dozens. And they swarmed into the hospital, one dozen after another. This is very much different from what we felt before. And fortunately, we didn't see the bad mood among the patients as we imagined. Patients understood us, and they were cooperating with our work. I remember one old auntie didn't understand anything about a field hospital, and she refused to take treatment, and she didn't trust the younger health workers. But after the care provided to the young health workers to the auntie, she changed her attitude completely. And she wrote later to us that I'd like to thank China-Japan Friendly Hospital. It has been a blessing to meet all of you. Your service and your management have left a touching memory with me. You are like my daughters and sons, and even better than them. And she also felt keenly the strength of the country, the compassion of the government. And she said that she has said the most number of thanks in the field hospital, more than all the thanks she had said in the previous years. There were other episodes as such. On the Valentine's Day, when patient sent a love letter to one of our team members, and another patient used his erhu, a traditional Chinese musical instrument, to play a song for us. There were also patients who wrote poems for us. When the field hospitals were closed, the police officers, the security guards, stood in teams to salute us. And all these have left us with valuable impressions. When we were in this together, we pulled through this together, and that is a valuable experience to enhance the compassion among all of us.
Thank you. Let's continue. On the left, the front row, the gentleman in the middle, please. Thank you. With the China Media Group, the news channel, we noted that your hospital was in charge of the treatment of severe cases. What was the biggest challenge and how did you address the challenge? Could you please share with us your experience? We will have Dr. Duan to take the questions. Thank you for your questions. When we first arrived in Wuhan, we were confronted with many difficulties. To deal with the situation, we optimized three things. The first, we improved the overall environment and the facilities. We tried our best to optimize the ward and equip ourselves with better devices. Within 24 hours, we improved the ward to receive the respiratory cases, and we created by ourselves a sound environment to receive the patients. So in a couple of hours, we received about 50 cases. Among our patients, there were severe as well as critical cases, and then we find some shortage in terms of the consumables. So over the night, from our home office, we got the necessary medical devices like the ECMO, the ventilators, and etc. These devices have really strengthened our capacity to treat the severe cases. And also, we had the mobile protective devices, which are very helpful. As you know, in the ICU ward, it is often said that we should have monitoring first. Without monitoring, it would be meaningless to talk about treatment. However, when we put on the protective gowns and the goggles, it was not so convenient to have the patient contacts and treatment. So we had the mobile monitoring devices, which are very helpful. And also we have the automatic monitoring devices. With these devices, we can be informed of the development of the situation at the earliest possible time. And also we optimized our team structure. Among our team members, we have professionals from different departments, and also with doctors and nurses. We divided the doctors into 3 tiers. The respiratory professionalists are in charge of the critical cases, and the severe cases were managed by physicians and doctors from other departments. And also we have the supporting departments to manage the overall ward and the less severe cases. Previously, we had a sound teaching and training system to treat the severe and critical cases, and also it has already become our common practice to use ECMO to save or to rescue the critical cases. So we applied all of them. Also, we set up some ad hoc procedures. For example, in our shift management and coordination for those highly risky, invasive practices, we will optimize the clinical practices or procedures to minimize the risk of infection. So with the equipment in place and the procedures optimized, our clinical practices were greatly improved. By the time we left Wuhan altogether, we treated 100 critical cases, and we applied ECMO 40 times, and also we had 4 ECMO practices. One of the cases was really a complicated case, and it involved the participation of many disciplines. Thank you. Let's continue. On the right, on the second row, the lady reporter in the middle, please. Thank you. With CCTV, among the medical Madam Sun Jing to take the question. Thank you. Indeed, in the work in Wuhan, we received a lot of critical and severe cases. Many of them are also complicated cases with symptoms developed very fast. We wish to have early identification and ensure the maximum stability of the patients. In terms of the nursing services, we cooperated with the doctors, and though we work in the quarantined ward and we were wearing the protective gowns, all the nursing procedures were conducted as planned, as we believe that this is the paramount task for us, and we should be responsible for the lives of the patients. One thing impressed us greatly. That was a patient, a very severe case. At that time, he was in a critical situation. In order to facilitate the recovery, we decided to have the ventilation for the patient. As it was a very complicated case, every time we had the ventilation practice, we developed plans, and also we needed 5 nurses to work on the same patient together, and the patient was intubed with many tubes, and a seemingly simple practice actually incurred a lot of risks, like the fluctuation of the blood pressure. So we need to ensure the sound functioning of all the devices, and also we need to monitor the data on the screens very closely. Also, for these patients, the pressure source are easily appeared. So we have to be very careful and monitor the patient very closely. So only when the patient is fine can we also feel relieved. So a seemingly simple approach is actually a full demonstration of professionalism and sound skills of nursing. Apart from that, the whole process takes at least 40 minutes. It is really energy consuming. We were wearing the protective gowns and goggles and wearing the gloves. All of these protective equipments made it difficult for us, but we always try our best to provide the best care. Another thing impressed me greatly. That was for the patients. They always felt worrisome and anxious. Also, for some patients, their family members were also affected.
We saw the tears in the patient's eyes. We tried all the means possible to help them to communicate with their family members by WeChatting, by video calls. However, more often than not, patients could not talk, could not write. So we really want to know their feelings. Nurses wrote down several letters: thirsty, hungry, painful, or uncomfortable. Then we turned this to the patients to understand their feelings, to know their needs, so as to better help them. Sometimes we touch the hands of the patients to convey and pass on the strength from the medical workers. We are with you. We can accompany you throughout this. Please feel assured and warm. We will always be at your side. Thank you. Next question goes to the journalist on the second row on the left side. Thank you. With the National Business Daily. In these medical teams, there are respiratory therapists, which is a new vocation, no skill involved. I'd like to ask, how did you carry out respiratory function support? I'd like to ask Mr. Xia Jinggen to take the question. Thank you for your question, and thank you for your interest in the role played by respiratory therapists. I am supporting Wuhan as a respiratory therapist, which is an important force in the ICU department. We are to provide the intubation and respiratory tract management to the severe cases. We have to contact the secretion from the respiratory tracts. After we arrived in Wuhan, the first thing we did was not to step into the quarantined ward directly. Rather, we've prepared different equipments and disposables. For example, the oxygen inhalers, the ventilators, and artificial lungs. All these equipments are essential for the support provided to the patients to support their vital signs. We must make sure that all these are handy. This preparation involves cumbersome efforts, but they are important. It was so cumbersome, at a certain time we may spend a whole morning to work on one little gadget or one joint. It's like when we go to the actual wars, we must have our guns and powders ready. We must fulfill the guns with the ammunition to win the war. In the clinical efforts, given the special feature and nature, on a daily basis, we have to have the sputum production, the establishment of artificial respiratory tracts. All these involve a high risk. On a daily basis, we have to evaluate the respiratory tract secretion, the quantity and the quality and nature of the secretion, so as to use physical or chemical ways to help to remove the sputum, even the secretion from the lower part of the respiratory tracts, which carries great significance to control the inflammation among COVID-19 patients. Sometimes we have to consult with each other to work on the protocol and the usage of the ventilators to maximize the efficacy of ventilator usage. We should also be accompanying the patient when they are in transfer to ensure the respiratory tract safety. When the situation is better, we are involved in the early stage rehabilitation. Therefore, we must ensure that the treatment protocol for individual patients must be personalized and precise. For COVID-19 patients, such efforts carry essential significance. Respiratory therapist is a new vocation. We were the earliest respiratory therapists that were trained by the government, and we felt keenly that if we can do this job really professionally, it can enhance substantially the quality of care. Thank you. I'd like to ask journalist to put forward the next question. Journalist from the fourth row on the left side. The journalist in white. Thank you. With the CNR. I'd like to ask a follow-up question on the roles played by respiratory therapists. As Dr. Xia has mentioned, on a daily basis, you have to contact the respiratory tract secretion and air, so there is a high risk of infection. Media reports also had it that the respiratory therapists were the ones that were closest to the COVID-19 patients. Were you ever concerned about your own safety? How did you overcome the psychological burden? Thank you for your question. The first time I stepped into the quarantine ward, I, as well as others, naturally feel the concern and the worries. The nature of this vocation requires us to contact the respiratory tract secretion and air. However, once we are there, the fear and the anxiety is alleviated. We concentrate and focus on the efforts. In this process, one thing carries the highest infection risk. That was the transfer of severe cases. In the early days, when we arrived in Wuhan, it was difficult to transfer severe cases because there were zonings in the hospital. So we have to put the patient on the stretcher and take him or her outside of the building, along with all the equipment, the oxygen providers. It means the mobile ICU has to be moved out along with the patient, and we have to walk 1 to 2 kilometers as we transfer the patients. Sometimes for the transfer of one severe case patient, it may need 5 or 6 medical workers to realize one transfer of a severe case for further treatment and diagnosis. So after each effort, all of us were in wet sweat. We had other concerns. In the early days, when we were on the way, there might be the wearing of equipment, including the boot covers and the masks. So we talked with the Tongji Hospital, and they arranged some ambulances to help with the transfer, saving the energy and protecting us further. Sometimes we sit together and consult the process of the transfer. As we accumulated more experiences of patient transfer, the fear has been fading away. I remember Dr. Yifan and Dr. Hui Feng have been engaged in several transfers, and they told us that the process became smoother and smoother. We also like to applaud and commend the optimism of the Wuhan citizens. They were the source of our inspiration. They have boosted our morale as well. And we felt it was incumbent on us to be even more courageous. I remember the first time when I stepped into the ward, there was an old auntie in her 60s. And he had the acute respiratory failure, suffered from great shortness of breath, hypoxia, and she was nervous. She didn't talk much. She had a poor appetite. And we told her that it's important that you eat. Then you will have the nutrition to subsist your immune system and realize quick recovery. She was very compliant. She tried to eat really scrupulously because it was difficult for her to eat. Whenever she ate, there might be hypoxia and anxiety. So how did she eat? She ate rice, take off the mask for oxygen, and then chew it, and then put the mask back again and take the next bite. It was really scrupulous efforts taken by the auntie to eat. She has been talking to herself, and she has been talking to us that was the hardest and happiest moment for her. She was like this for 2 months, and she successfully was transferred out of the ICU ward and got recovery. Another old grandpa in his 70s was also a very severe case. When we saw some positive trend, he was like a child, and she even showed us a victory gesture, and she said, yeah, just like give you 5, just like a little child. We were touched by all these little episodes on a daily basis. There were just too many of them. In a quarantine ward like this, it was our honor to treat all these courageous patients.
Thank you. Let's continue. On the left, on the third row, the reporter in black in the middle. Thank you. With CETV. Just now, Dr. Xia mentioned Yifan and Hu Weifeng. Actually, people are also very concerned about these two physicians, and we were informed that Dr. Yifan was discharged from hospital upon recovery, while the other doctor was still under the treatment. So how about the two physicians? We will have Dr. Duan to take the question. Thank you for your question, and also thank you for your concern and the care for the two physician patients from the Central Hospital. Just now, I mentioned that we had received the medical equipment which enabled us to treat the critical cases. Both of the physician patients were hospitalized in the end of January. I remember that it was a heavy rainy day in the evening, and as you know, the use of ECMO or the management of ECMO needed a whole team's efforts. And as a national medical team and also the National Respiratory Center, it is our due responsibility to treat the critical cases. So we decided to transfer these two physician patients to our ward over the night, and we had the assessment and provided treatment. So with the support of ECMO, we conducted the mobile CT scanning, and on the second day we had the bronchosectomy, and we found that both of the two cases had the infection in the blood. So we had to change the blood, and to make it successful, we need to change all the tubes connected to the patients. Despite the sound plans we have developed, there were some unexpected situations. That was the cardiac shock. So at that time, we had no other thoughts. The only idea was to rescue the two cases. I'd like to express our appreciation to the Zhongfa Xinchen Hospital of the Tongji, and within 30 minutes, we got the coordination, and the situation of the physician patients was stabilized. However, the patients were still in a grave situation of severe infection, and nobody was confident enough to do the ECMO transfer. So at that time, the academician came to us and offered us the guidance. We still need to change the tubes, and it was indeed an arduous effort. And when we succeeded in doing so, on the second day, the situation of the patients was stabilized, and on the third day, Dr. Yifan, one of the physician patients, was awakened, and I remember vividly that he wanted to ask a question whether the ECMO tubes have already been stabilized or have been fixed, because he was an expert physician in respiratory diseases, and he knew how important the ECMO tubes fixation is. Now the two doctors are recovering, and Dr. Yifan no longer needed the ECMO tubes on the 14th day. He was already discharged from hospitals, while the other doctor was still in hospital, but he no longer needed the ECMO support. I know many people are quite concerned about the darkening of their skin, and that was because we used a medication which will cause the darkening of the skin. Well, it is not necessary to worry about the color because it is reversible. We have made constant communication with these two doctors. We've already become the comrades in arms, and when Dr. Eve got the news that I am going to come to today's press conference, he sent me his photo this morning, and he wanted me to show his photo to you and to express his appreciation to all of you. So you can see on the left the photo he took this morning, and this one was the photo taken on April the 6th. So you can see that Dr. Yi Fan was a very handsome man when his dark skin gets back to normal. Okay, let's continue. On the right, on the third row, the lady reporter, please. Thank you. With Hong Kong Economic Herald, the makeshift hospital takes many more patients than the regular hospitals. So, in terms of the treatment and the patient's care, what are the differences and how do you deal with these difficulties? And we will have Dr. Wang to take the questions. Thank you for your questions. Indeed, the large number of patients in the makeshift hospitals mean that we are faced with a heavier workload. We come up with some easy and simple procedures to address the specific needs. These protocols are easy to realize, and also in receiving the patients, we made a constant improvement to the previously established protocols. Also, we cooperated closely with our sister hospitals and colleagues. So, also we offered psychological support to the patients. In the whole process of patient treatment in the makeshift hospitals, we have adopted the standardized approach, and then with this people-oriented approach, we effectively controlled the development of the symptoms. For doctors and nurses, we were divided into shifts, and there are specific personnel or professional in charge of the designated patients. So, and also with the close collaboration between the medical professionals and the patients, we ensured the orderly treatment of the patients, and every member of the medical team has won the confidence and the trust from the patients. The virus brings out the best of the humanity, and in the makeshift hospital, we also provided health education activities or health promotion activities. Such activities are of various forms, ensuring that the treatment and recovery are working together. Also, in the light of the COVID-19 features, we developed the respiratory exercise, which will be done twice a day, one in the morning and in the afternoon. This is also very popular among the patients. So with these sound practices, we have made the makeshift hospital a vibrant place, because we also have very young professionals.
So we were said as the commando team in the field hospitals. From the time when it was opened, when we stepped into the hospitals, till the time the field hospitals were closed. That was an unforgettable experience, a great opportunity for growth, a great honor enshrined in our heart. After days and nights in Wuhan, it was felt keenly that the solidarity to Wuhan from across the country. We felt the selfless fraternity. We also felt keenly the thanks and gratitude from the patients, the dedication and from the volunteers, the trust from the local colleagues, the local government's sound support to us. In retrospect, that will always be an experience enshrined in our heart. It may not be that we supported Wuhan. It was a great lesson from Wuhan to us. We know better how to shoulder the responsibility. I'd also like to take this opportunity to pray again for Wuhan. Also, our best wishes for our motherland. Thank you. Last question for the day goes to the journalist on the fourth row on the right side. Thank you. With the Macau Monthly, I have a question for Madam Sun. You were the head nurse, one of the nursing staff. What was the greatest challenge felt by you in this COVID-19 fight? Thank you very much for your question. After we arrived in Wuhan to treat more COVID-19 patients, we need to change the ordinary ward into ICU wards in the shortest time. Such an ICU ward should be a quarantined ward for the taking in of infectious disease patients. We should also satisfy the needs for rescue and treatment. Therefore, we need to ensure all the conditions are ready. Equipment, facilities, medical products, disposables were all in place. We tried our best to start from scratch and build such a ward in a short time. It was not an easily won achievement. All our team members came from different disciplines. It was an very strange and different environment for us. We naturally felt anxiety. How can we ensure that they can feel alleviated? It was an interim ad hoc team, but we needed to be a highly efficient team. That was another big challenge for us. In this Wuhan mission, we had colleagues from the ICU department, respiratory disease department, and other disciplines. To do a better job for severe case management, we need to standardize our procedures, including the standardized training, so as to ensure consistency of the caring quality and ensure that the coherence in our caring and nursing. There were many young nurses. Before the first time of stepping into the quarantined ICU ward, they were concerned about the specific operations. They didn't know how to ensure the smooth operation in this thick and heavy protective gear, which could be naturally understood. It involves a greater strength. After we stepped into the ICU, these puzzles immediately went away. No difficulty was in the way because what we saw were the eyes for life, were the aspiration to live on. That filled our hearts, and we remembered that we can cure, treat, comfort, and relieve. There was a voice talking endlessly to us: persist, carry on, stay strong. And it was because of the belief that we completed all the nursing items in this thick and heavy protective gear, and their recovery filled our heart with the highest level of gratification and happiness. Thank you. I'd like to thank all the health experts and professionals for sharing with us their unforgettable experiences. In the COVID-19 response, many places have set up video teaching, and students have to take lessons online, and use electronic devices. Therefore, there is the concern as to how to use eyes scientifically and healthily. Tomorrow is the weekend day. We'd like to invite experts to share with us some tips on the prevention of short-sightedness among the minors. With that, we conclude today's press conference. Thank you.
아, 보이.